All right, now here's something that Kendra asked about. Wait a second. Hey, I don't believe you can palpate all that stuff. Well, I'm just going by what the book says. And I think obstetricians, you know, with all their training, using a bimanual approach, okay? Not only palpating through the vagina, okay, but also palpating in the front of the abdomen, over the pubis, and pushing back, okay? They can push back and they can push things around from the front here and do bimanual palpation and palpate these things, okay? So I listed the things that you can palpate there, and you need to be aware of them. And what I would do, instead of writing them all down, is I would find that page in the syllabus, I forget which page it is, but to find that page in the syllabus where I listed them for you. I'm going to tell you what they are, but I don't think we should take the time to have you write them all down. Urogenital diaphragms, urethra, bladder, rectouterine pouch of Douglas, ovary, oviduct, broad ligament, uterine artery, ureter, ileum, rectum, and the pelvic side of the pelvic diaphragm. Okay? Those 12 things are listed in your syllabus. All right? So what you write down is find in the syllabus 12 things palpatable through the vagina. Right? Okay. Now, how about the connections of the broad ligament? Well, what does the broad ligament connect? Well, through the mesovarium, it makes contact with the ovary. Through the mesosalpinx, which it makes contacts with the uterine tube. Through its connection from the pelvic wall over here, we're looking at the left side, okay, because the ovary is posterior. This would be the left wall of the pelvis, right in here, okay, so the left wall of the pelvis would be here. Broad ligament would be going from the left wall of the pelvis over to attach to the uterus, okay, clearly. Right on the side of the uterus, okay, that's what the broad ligament is going to be attached to, okay, and this is going to be the position of the cardinal ligaments down here, okay. What the heck is a pelvic splanchnic nerve and what's in it? Well, a pelvic splanchnic nerve is a parasympathetic fiber. Later on, we're going to learn, if you choose to, or happen to, or get to, or whatever happens, you'll learn about some other splanchnic nerves. But these are pelvic splanchnic nerves. They come from a spinal nerve, and they go over to that autonomic plexus, and they are preganglionic parasympathetic fibers. That's what you want to be aware of. What kind of fibers they are. They're parasympathetic fibers, and they haven't gotten to a ganglion yet. Okay? I can tell you more about that, but let's just take that on faith for the time being. Okay? Parasympathetic, preganglionic, parasympathetic fibers. Okay? That's what they are, coming from a spinal nerve and going over this way. All right. Man's having a problem passing urine. Happens all the time. All the males in the class. I'll tell you what, if you get old enough, you're going to have problems passing urine. It's going to slow down and may even stop. And you say, by golly, I hope it's benign prostatic hypertrophy. And they can do a little roto-rooter procedure on me. Okay? Because when that happens, chances are there's something wrong with the prostate. And if it's cancer, then you can feel it. Albeit in a more advanced stage, of course. You're really going to want to rely on that prostate-specific antigen that you test in the blood to catch it early. Okay? That's why it's a good idea to have a PSA done pretty frequently beyond the age of 50. Okay? But palpate the prostate clearly and rectally. Okay? What's a gray ramus communicans? Well, I tried to show you one, and it was a kind of a crummy one on table 2 on Tuesday. It was all dried up, and the sympathetic trunk was all dried up, on table 1, there was a really good sympathetic ganglion, okay, that Timmy stuck a pin in, okay. Unfortunately, that sympathetic ganglion didn't have a connection with the spinal nerve. If it did, we could call it a gray ramus communicans. So by definition, what you want to know is that a gray ramus communicans is connecting a sympathetic ganglion to a spinal nerve. The fibers are going in this direction, from the sympathetic ganglion to the spinal nerve. As opposed to these ones down here. These are pelvic splanchnics. Pelvic splanchnics are passing from the spinal nerve towards the pelvic plexus. They're going in the reverse direction. These are passing out of the sympathetic trunk, going into the spinal nerve. Okay? I can tell you more about the story there, but I think we're just going to keep rolling. All right? How about that ureter? Well, the ureter is going to be vascularized by anything it comes anywhere close to. So the renal artery is going to vascularize, the spinal artery passes over the common iliac artery clearly. Common iliac is going to vascularize it. Internal iliac is going to vascularize it. The vesical arteries, inferior vesical arteries are going to vascularize it. And then it passes inferior to the vas deferens, and I hope that's clear to everybody by now. This is water under the bridge in the male. Water under the bridge in the female is the ureter under the uterine vessels. Passes inferior to the vas deferens and obliquely through the bladder. That's how it has sort of a mechanical closing action. As the bladder swells up because it goes through diagonally, swelling up squeezes the passageway closed. So as urine fills the bladder, it tends to mechanically close off and prevent urine from going back into the ureter. So it passes obliquely through the bladder. Okay? How about the joints of inversion of the ureter? Well, this was kind of out of sequence, but by golly, this is something we want to focus on. There are two joints of inversion of the ureter, the subtalar joint and the transverse dorsal joint. Okay? The subtalar joint is the one between the talus and the calcaneus. There's a part where the talus and the calcaneus only articulate with each other. There are two parts where the talus is articulating with the talus, with the calcaneus, and with the navicular. So these two parts are not the subtalar joint proper. There are other parts of the subtalar joint that actually get involved with the navicular bone as well. Okay. Be that as it may, this is a subtalar joint. This is a transverse tarsal joint where the talus now is articulating with the navicular and the calcaneus is articulating with the cuboid. So the two joints of inversion and eversion are the subtalar joint